Good morning, everyone. Respected dignitaries, the management of Jain College of Allied Health Sciences, dear students, it's my privilege to be here, and it's daunting to address a group of cancer biology students about cancers, right? I'm not prepared in that direction, but I will try to do my best. You're all young minds with good information about cancer biology. And at the outset, let me thank the organizers for calling me here, trying to share my experiences and views about a disease which most of us would not like to really hear very often, correct? We don't want to be listening about it, but there is much more to cancers than getting afraid or trying to avoid it. So I would try to make it as interesting as possible. Let me see where I will stand on that count. Um, I have been in the field for the last 30 years or so. Like many oncologists, our journey is not very smooth with patients. There are experiences good and bad, hopeful and hopeless. But in the end, all of us learn that it's a progress. It's never a static journey. We all progress during our course of career. So I would rather go that way and make you feel interested about this particular topic. How many of you have read this book by Siddharth Mukherjee? Cancer biology students. No? Yeah, sure. Please go back and read it. It's written by one of the cancer surgeons of US, very well known. It's a very interesting book which will open up your eye about other aspects of cancer than the technicalities. I think one should read it. It's part of our own body cells. As you realize, we don't have real defense against it. That's why we develop it. We can't face it like other infections. The body overcomes it. That's not the case. It quickly becomes a way of life or death, depending on which stage it is coming to us and what treatments we are going to offer. I think all of you agree with this opening statement. I'll try to make it into two parts. I was confused actually what exactly I would be addressing you people. I would try to go with a little bit of data, a little bit about facts, and a little bit about personal experiences, and try to get the message across to you. Famous statement by one of the very renowned psychiatrists. These are all facts. How you interpret them is up to you. How you take this message is up to you and then imbibe it. You are all very young. So these facts have to be taken in the true spirit of development, how it will help you in your future. So take it in that fashion. And how you get the best result is up to you out of this presentation. Next slide. This is a common question I get in the OPD when I see cancer patients. Very common for somebody to ask, I don't smoke, I don't drink, I'm a vegetarian, why I'm getting this? Okay? So let us address that question from here. Next few slides, I think cancer biology students should be very familiar with. Let us see how much you understand my point of view. Okay. Most of you are aware what exactly happens with cancers. Can anybody say yes or no? Most of you would know what is happening with cancer cells. Next slide. I'll be very brief because it's not a topic which I can go into depth in this forum. Okay. We all grow in our size. We grow in age. Our body develops because cells are actively dividing. You accept that. Okay. This is a regulated process. Cells are regulated in their growth. Okay. When that regulation goes, cancers develop. How that happens is here. Whenever there is injury to the cell, either it is repaired or it is eliminated. Only two possibilities. Either repair happens and cells get back to normalcy, or they are eliminated by death, called as apoptosis. Right? This is a normal mechanism. There are some checkpoints. The cells are stopped at some points. They are repaired or they are sent to death. If neither of them happen, it becomes an immortal cell or a cancer cell. Next slide. What helps in this development? There are two genes, tumor promoting, tumor suppressor. Either they increase the tumor promotion or they decrease the tumor promotion. Either the tumor promoting gene is more active or the tumor suppressing gene is inactive. Either one of the facts happen for cancers to develop. Immortality is the hallmark of cancer. It doesn't die. It grows, keeps multiplying endlessly, invades the whole body ultimately. At some point, body cannot cope and then people die. That's how mortality happens. Next slide. How many of you know runaway trains? Anybody is aware? The sir knows. Runaway trains are, if you watch National Geographic or Discovery channels, even in India it happens. The train goes without a driver. Driver has got down for some accidental thing. The train is on locomotion. It goes and crashes some point, okay? Cancer cells are something similar to that. The driver is out and then some bad activity happens with the cell, ultimately it crashes. So cancer cells are similar. Cancer biology students, are you aware of telomeres? Yes? What is normal about telomeres? Apart from cancers? They shorten the length, right? And what happens in normal life with telomeres? We age. The aging, somebody asked me just before we met, telomeres are part of our aging. We age because telomeres are active. They limit the growth of the cell. Ultimately, people age. Okay. I think, are you aware of the Google trying to prolong longevity? Google is very actively involved in prolong our longevity working via telomeres. They want to see how telomeres can be inactivated. Okay, it's a very interesting subject. Okay, that is brought about by an enzyme called telomerase. This telomerase keeps the telomeres not short, long, so that longevity goes up, aging stops. But that is what happens with cancers as well. The telomerase is one which pushes the cancers up. So it's a double-edged sword. Either we age, or if we don't age, we risk developing cancers. It's something, a common ground. So this is one more aspect of cancer development. Sometimes the faulty mechanism is hereditary. We were discussing before we met. Hereditary cancers account for around 5 to 10%, not much. Among 100 patients, we see 5 to 10 are hereditary, means they are familial, they run in the families. I was talking about this. Do we have natural defenses against cancers in our body? What stops cancers? Okay. What are the natural defenses for anything? We had COVID virus, right? One of the very big health scare we had last 2 years back. What was our defense against COVID? Was it antibodies or was it T cells? T cells is for long memory. Antibodies are immediate, right? T cells is memory, like for your vaccine, it remembers, T cells are activated later on. Antibodies are immediate to infection. Unfortunately for cancers, it is not such a well-developed mechanism because cells are our own, it is our own cells, body doesn't act so well against cancer cells. So there is no natural defense which is strong like against a virus. That's about the T cells. From biology, I think that's where I'm going to stop at cancer biology. I won't go more than that. It's a very vast topic. I won't be doing justice discussing in detail here. Let us look at some statistics about our own country. Okay, where do we stand? We got that unwanted distinction, right? We are the most populous country in the world. With that comes all the problems of the volumes of cancers. Okay, we have large volume of cancer patients, right? Some data, around 1 million cancer patients every year in India, around 10 lakhs. Half of them die. Gross statistics, it could vary from place to place. 1 million cancer patients, half die. By 2040, that figure is going to be double. Means 2 million, 1 million would perish to cancers unless some dramatic developments of management comes. These are the statistics. Little bit going more deep, for every 1 lakh population, we have around 100 developing cancers and 50 to 60 dying of those diseases as of today. What are the commonest cancers? Can anybody? Breast, because lung cancer is very common, okay? But apart from breast, in women, it is a cervical cancer which is more common. You will find some interesting developments which I will bring forth here, okay? Oral cavity, all tobacco related are again common cancers, okay? Now what's happening with sexes, female and male? Where do we stand with cancers, okay? Which is more common in women or in men? Women. That's again an unwanted distinction, right? Women are showing more cancer incidence than men in India for some reasons which I will discuss in my presentation. If you see that 1 in every 20 women in their lifetime are likely to develop breast cancer. Assuming that we live till 70s or 80s, out of every 20 women, one woman is likely to develop breast cancer. That's a very large figure, right? So what we do is something we discuss at later part of the slide. Are these cancers equitable? No. Any student, can you tell which part of our country has the maximum number of cancers for a geography? Anybody? Let it be interactive discussion. Madam says North India, Punjab. Correct, correct. But taking all together, there is one area which is really very high density. I'll put that slide. It's the Northeast. It is the Northeast which has got plenty of cancers for a given demographic population. Okay. We'll see this slide. That is in males, that is in females, right? See those 5 districts there, 5 states there. They have the maximum incidence in our country. All are from, most of them are from the 7 sisters, Northeast, right? Okay. Why it's happening like that? Population is more and population is less. The fact is, population is more or less same. Tobacco usage is rampant, the highest in these states. Availability of cancer treatments is the least. I'll come to that. Okay. If you see down, if you come down like this, that is a district in Maharashtra, Bid. Okay, very backward district, but the lifestyle habits are totally different. So the cancers are the least in this part of the state, in part of the country. So ours is a diverse country. We have a very different spread of cancer patients. Okay. Past to present, what's happening? What was the situation 10, 15 years back to what is the situation now? It's a big slide. All red is increase, all green are decrease. Okay. I don't know whether you can see it here. I'll point out a few cancers which you can see. What's happening to the breast? Increasing everywhere in the country. Be it Northeast, be it Punjab, be it South, be it East, West, breast cancers are up. On the contrary, see here what's happening. Cervical cancer, okay, which used to be the commonest cancer 15 years back, uniformly it is coming down, except for few states. Again, I think somewhere up there, everywhere it is down. That green indicates good. Why have we achieved this good distinction? Early diagnosis, pap smears, okay, gynecologists everywhere trying to check women. That is where we are picking up early cancers, trying to treat them, removing the uterus early. Okay, we are reducing the cervical cancers. Apart from that, if you see lung, why this? Lung cancers in females. Why? Smoking. Active smoking, not passive smoking. You'll be surprised the incidence of active smoking in the young women of India is pretty high. Contrary to what we want to believe, it's high. Okay, this is a figure. This is not some theoretical thing. Our lung cancers in females is highest. We see a lot of young women, 40s, 50s, coming with lung cancer. They all think I got some chest infection, tuberculosis. No, they have lung cancer, okay. And similarly, if you see men, surprisingly, men are showing some decrease everywhere, here and there, okay. Probably they are taking better care of themselves, going to doctors more often, trying to check themselves up, leaving women at house, whatever, right? But it's a social situation which I think, unfortunately, we discussed that also as well. It's happening that way. Okay. In what stage these cancers present? No guesswork here. Most of them are locally advanced. They are not stage 4, but they are not stage 1 also. They are usually 2 or 3. So we are looking at a cure of around 30 to 35 to 40% in any cancer. That is where we stand. Okay. Lung cancer presents with very advanced stage either in men or women. Unfortunately, many don't make it through. What is common for these three women? Anyone? I'm sure you will detect. I don't think anyone has got breast cancer among them. Lisa Ray had something called as myeloma, if I'm correct. Manisha, ovarian cancer. She didn't tell what she had, but she had metastatic cancer. Okay. What I'm asking is, what is common amongst them? Educated, well-to-do. There is one very important thing about them. Age. They were young. They are not in that cancer developing age, right? They were all young. All of them were in late 30s or 40s when they were diagnosed. Okay? That is not an age for developing cancers. So next few slides on that particular aspect. They were not expecting to develop it. They never imagined that they could get it. Correct? Cancers in the young. There are two aspects. Okay. One of the madams was asking me, the newborns also develop tumors and cancers. Why? Definitely there is no environmental factor there. It is all genetic. The genetic framework is abnormal, right? So there are some cancers which are very common in young children, means 10 years, 5 years, 15 years, okay, like abdominal tumors, bone tumors, some blood cancers called leukemias, they are very common in the young age, okay. We are talking about this here today, the shift. Cancers which were supposed to be happening in the old have slowly shifted back happening in the young people. We call it as a shift. And why is this shift happening? That is what I would like to address in my next few slides. Okay. There was an article recently in all the major newspapers, Times of India, Indian Express. Okay. Around 79% increase in adolescent and young adults cancers in India. Little bit of my personal experience I will share. We see around 40 to 50 cancer patients every day in our OPD. Reasonably good number would be young patients. We first confuse them to relatives. We think that she is accompanying some cancer patient. Unfortunately, the mother will be accompanying the daughter who is a cancer patient. It is like that. So we have got accustomed to this to expect. When they say we look at the age, we realize that they are young. Okay. So this slow shift is happening. I would rather spend more time on this particular aspect here and discuss why. Young means less than 50 by Western standards, 15 to 39 according to Indian definition. But less than 50 still is meaningful for us because less than 50 is not an age to develop cancers. So let's see why it's happening. Which are the common cancers which are now seen more commonly in young women? Breast cancers. I've got good number of IT women, young women who are married with a one kid, breastfeeding, confused at the breast cancer for a breast abscess or some milk swelling coming, getting diagnosed as breast cancer patients. Okay, it's not common, but it is not uncommon either. Okay, the shift is slowly happening like that. We'll look at reasons why. Colorectal. Colorectal is large bowel, correct? So this shift, again, unexplainable, but many young women come with rectal cancers, colon cancers. They have some motion problems. Stools are not okay. They never suspect. They think it is hemorrhoids or piles. Unfortunately, they turn out to be rectal cancers. Okay. Third is ovarian. I think 2 weeks back, we treated a young lady who was trying for infertility. She was taking hormonal treatment for becoming pregnant and then incidentally was found to have an ovarian mass. So the gynecologist told that these are normal tumors which can happen during these sort of things. So go and get a checkup done. Most likely it will be normal. Unfortunately for her, she got operated outside thinking it is a normal tumor. And it turned out to be a malignant tumor and a high grade one. Once this happened and they thought it is a benign tumor, she lost all the opportunity to save herself of fertility. She had to get the other ovary, uterus, everything removed. So unfortunately, she opted correctly for life over fertility. She said, let me be alive. No, don't bother about fertility. Okay. So we had to reoperate on her and get everything off. So these are the three common cancers which are happening in young women now. Some cancers have come down. Why this shift? Let us look at few factors. Everybody talks about this. Don't get obese, don't eat junk food, don't be a couch potato, etc., etc. But it goes out of many people's mind, right? We don't. It is not easy to give up pleasurable things. But how obesity is linked to cancers is a very interesting biology subject. So let us look why it happens like that. Tobacco, alcohol, yes. More young people are now taking tobacco and alcohol. Does Environmental Pollution Act? WHO has warned that the diesel emission is likely to cause cancers, lung cancers. No definite proof, but yes. And stress, no proof. If you are overstressed, will you develop cancers? There is no such conclusive proof. Mobile phones, again, no proof. So using more mobiles, brain cancer and all, more sensationalistic news. As of now, no evidence that they lead to any cancers. Young people develop cancers definitely because of hereditary influences. Mother has cancers, sister has cancer, definitely higher chance. Okay. Which are the cancers which are associated with obesity? Breast, uterine, ovarian, and colorectal cancers. How does it cause? What is that thing wrong with fat which causes cancers? Okay, this is the substance in the fat cells which is stimulating the cancers, normal cells to become into malignancies, especially in certain areas. Okay, adipokine induces signals to develop cancer cells. That is a biology link between obesity and these cancers. The early onset colorectal cancers have been directly linked to this substance in young women and men. Excess intake of sugars, is it linked to cancers? Not directly. More sugar, more obesity. Obesity linked to cancers, indirect link. Inflammation, definitely yes. Many people think that infections and cancers are different things. Unfortunately, they share a common path. Inflammations and can lead to cancers over a long period of time. There is a very similarity in biology between inflammations and cancers. So it's a very interesting path for biology students to look into that. Why inflammations lead to cancers? Let us look at hereditary factors. What are the common hereditary cancers? Breast. Unfortunately, even with a strong family history, many women just don't think that it is hereditary. They ignore it. Sister has, mother has, grandmother has, but they don't think that it is hereditary. They come back. They also get it. Okay. So we check for a mutation called BRCA1 and 2 in breast cancers. If it is positive, chance of developing breast cancer is 70%. Okay. So there are methods to address that thing. This condition called as familial polyps, the colon is studded with small swellings called polyps. If it is familial, it carries a gene called FAP gene. The development of colorectal cancer is 100% by 40 years of age. If FAP gene is positive, by 40th year, all of them do develop cancers. So we prophylactically remove the colon in all these patients if it is positive. This is a very common syndrome. I have somebody from Infosys whose 4 family members have similar cancer due to Lynch syndrome. Unfortunately, it was detected late and both the sons also have it. So it is like that. It's very, very common, only we don't diagnose it. When should one suspect hereditary cancers? When there is a strong family history, young age onset. The moment somebody comes young, first thing we ask is anybody in the family having cancers? Okay. Bilateral cancers. People come with both sides, breast cancer, we suspect familial history. Second cancers, one cancer now, one cancer after 10 years, we think that family hereditary could be a issue. Does stage matter? Yes. Higher the stage, bad the outcome. Okay. Apart from that, there is a logistic angle to higher stage. That is, more tests, more doctors are involved, more treatments, lengthier stay, more importantly, the cost of treatment goes up. Correct? Women and cancers, as I said, women have more incidence than men in our country. Okay? Some data like that. Look at this. The disturbing race is fueled by one cancer, that is breast, and lung, that is second. Third is colorectal. This statement, you see this. They not only show a race, but they fare badly compared to men. Suppose there is a man and a woman who are undergoing treatments. In our country, the women fare slightly bad in the outcomes than the men. Various reasons, but that is a fact. It's a scientifically accepted fact that women fare slightly bad. Why women are showing rising mortality trend? The rural women, surprisingly, a lot of people take tobacco. Okay, so they fare badly when surgeries are done or treatments are given. Obesity, the moment somebody is obese, they don't tolerate treatments well. The good cancers have come down, cervical cancers, so outcomes are poor. Delay in approaching cancer specialist. Is there a bias? Yes. Yes. If there is a family, the man prefers himself to first consult, leaves the women back. It may not happen in urban household, but it is very rampant in a rural house. Okay, women stays back, goes late. So it's the other way around when it comes to men. So these are some reasons why more women fare badly. So I see more women in my OPD. I have more women under treatment and more women getting admitted in the wards, okay, than men. We are talking about empowerment, right? But I don't think we are doing the right thing still, okay? Time that everybody acts on that particular part. Little bit about treatments. I won't go into details because it's a very vast topic, okay? All of you are aware, we operate, we give radiotherapy, we give medicines called as chemotherapy, okay? Newer agents are targeted medicines, okay? I won't bore you with details about these things. What is different about surgeries? I think somebody asked me about robotics, right? Can anyone tell what is that surgery now than was in the past? Just for a discussion, instead of having one-sided talk like this. Any student? Madam says surgeries are image-guided, robotic surgeries. Can somebody say what is it that the advancement in surgery which has made some impact? They are less invasive, they are more safe, they are more safe. They are not dramatically removing more cancers, no. The surgery now doesn't remove more cancer tissue than what has been removed in the past. We remove that much only, we actually remove less now. Surgeries are more conservative. Previously, whole breast used to be removed, we now remove only half the breast. Okay, previously we used to remove, putting a big scar, now we do it with a small scar. We don't remove more, we remove what is required and we do it more safely. So surgeries are more safer than extensive, okay. Radiotherapy is similar. The mechanism of radiotherapy has not changed, the extent is not changed, but how we deliver radiotherapy has changed. Sophistication in delivering radiotherapy. This is where all the advancements are happening, okay, the medicines, okay. If I may point to one aspect of it, it is this. All the medicines are targeted now, okay. They target specific area of a cancer cell. They don't act in a gross fashion entire body, okay. That's where cancer medicines are developing. What is the impact treatments have made? These are all the cancers where the impact has been good. Means patients are doing well, survival has become better. These are the cancers where still we don't see good improvement. We don't see good outcomes in these cancers still with treatments. Very famous cancer surgeon, way back in 90s, this was his statement. Tumor biology is the king, selection is the queen, technical maneuvers, robotics or radiation, they're all prince and princess, okay. The prince and princess try to dethrone the king and queen sometimes with temporary, but only victory which is not to long-term avail. They are not long-standing, okay. They almost always fail to overcome the powerful forces. What does this statement mean? Can any student put a highlight? What does this, it's a very, very important, powerful statement for cancer, people who deal with cancers. Yeah, recurrence. Why recurrence happens? Despite your technical prowess, using robotics or using best medicines, what is it, that aspect of this statement which is harming? That part. The king, right? Nothing can usurp the king because king is a king, right? All your technical prowesses won't come to help, right? What is selection? The type of cases we operate. You take a stage 4 cancer and try to do the best treatment, no much success. Okay? So what does this say? We need to know which tumor has got a good biology and which is that which is in a good stage. If you don't choose like this, you are likely to fail. Just a small example. In stages 1 and 2, the cure for a breast cancer is 70 to 95%. In stage 3, it drops to 40%. In stage 4, it is almost negligible, right? So that is stage. Biology, we do these tests now for all breast cancers. What are they? We look for this pathology, whether it's a good or a bad pathology type. We look for the hormone receptors, estrogen, progesterone, whether they are expressed or they are not expressed. We look for these factor called HER2/neu, which is, what is HER2/neu? Any cancer biology student? Any cancer biology student can tell what HER2/neu is? Does it come in the cancer biology? What is it? Your teacher is going to catch you otherwise. Which growth factor? Yeah, good. It's an epidermal growth factor, okay. So if this is expressed, the outcomes are poor, okay. And this is for mitotic activity, right. So we check all these for every breast cancer now. No treatment is planned without this. 10 years back, no such plan. Any patient comes, remove the breast, give some medicine, send home. By 6 months or 1 year, 2 years, 50% would be gone. There is a shift. Without this, no more treatments now. Okay. Mortality, there is a slight perceptible fall in deaths, means less deaths. Men showed more improvement. 5 commonest cancers where deaths still happen: head and neck, stomach, breast, lung and colorectal. Mortalities have gone up with lung, colorectal, breast and gallbladder. Breast, we should not be losing patients, right? Why are we losing patients to breast cancer treatment? Late stage, something else? Yeah, something to do with this HER2/neu epidermal growth factor. Triple negative is very bad disease. This HER2/neu, there is some aspect to this HER2/neu and many people not able to manage it, cost. The drug against HER2/neu receptor is very costly, called as trastuzumab. That is a drug which is used for when patients express this epidermal growth factor. Many can't afford it, they fail badly. Money is the issue. See, what is personalized medicine? Not everybody gets the same. Okay? All of us don't wear the same shirt or the same this thing. We each have our own preferences. Similarly, every cancer patient gets a personalized approach. We check genetic level changes. We check for gene abnormalities in most cancers and try to personalize the outcomes and treatments. Few last slides. Is there a disproportionate spread of cancer treatment facilities in country? Would you accept it? Again, coming back to our slide, everything there, northeast, correct? This is a train map from northeast to Bengaluru, right? How much time it takes? 2.5 days. 2.5 days from Dibrugarh or Guwahati down to Bangalore. Do you know that there are at least 3 major cancer centers in this route? One in Chennai, one in Vellore, Bangalore. Many cancer patients travel all the way from there to here. Previously, they used to go there, to Mumbai. Now, most travel like this. Most of them get down here at Kadugudi, Whitefield, right? This is the most cancer-rich area, the least cancer treatment facilities. most centers here in this area. That is a disproportionate spread. Lack of radiotherapy units, lack of specialist care, expenditure, most can't afford, right? Despite governmental support, 80% people still spend out of their pocket. No insurance support, and most of them have to bring money, sell something, get money and buy and do things. They cannot do that. What are the future directions? Very huge topic, impossible. Okay. Uh, Artificial intelligence, again, we were discussing before we met you. AI is going to play a big role in diagnosis of cancers. Okay. It will reduce the burden for cancer specialists. It will tell what to check and take all the inputs, simply give you a diagnosis. Okay. But don't believe the chat GPT, that's not going to help. Okay. That's more of a deviation. Teleconsultation, somebody sitting at far off place can take the help of a specialist in the center, make use of it. Okay. This, how many of you have read the book called Sapiens? It's one of the most read book and wonderful book. Okay. One of the most famous historians. What he says, 90% of lung cancers can be perfectly detected by a AI based algorithm. Can anybody say what an algorithm is? For a diagnosis, what an algorithm is? How is it worked out? Suppose a cancer specialist is sitting, he sees a cancer patient of lung cancer, he is asking, do you smoke? Do you have cough? Do you have breathlessness? Do you have this? Do you have that? And finally he comes to a diagnosis, right? Based on his experience. In AI, you feed all this data into a system, look for a diagnosis. Okay. Artificial intelligence, as per this author, is likely to be more accurate than a specialist to tell whether a person has a lung cancer or a tuberculosis. Okay, example. So we are going in that direction definitely. Future is with artificial intelligence. This is a concluding statement. This was from the World Cancer Day. What is the theme for World Cancer Day? For 3 consecutive years, 22, 23, 24. Close the care gap. That is the theme by the WHO, World Health Organization. There is a lot of gap between the care available and care provided. Okay. What does it say? Young and old, rich and poor, black, white, male, female, trans, right or left, east and west, all agree that powers to be make the world aware that we need to close the gap. And gap is going to be closed not by taking somebody to a big cancer hospital, but by spreading word of mouth and awareness. Simple awareness goes a long way than making them access to a very costly treatment. You agree with that? Yes. That's my last statement. Thank you.